Hello, everyone, and thank you for joining us today. We're thrilled to have Charles Scruggs with us, Director of the Pre-Professional Advising Center and past president of the Western Association for Advisors of Health Professions at the University of California, Riverside. Um, Charlie, thank you for being with us today. You have an extensive experience, and I'm sure you're going to be pivotal in helping our students who are watching this today in their journey towards medical school. So thanks again for being here with us today.
You bet. Thanks, Patty, for having me.
All right, thanks, Charlie. We'll jump right in, and maybe you could start by maybe sharing a little bit about your experience advising pre-health and pre-med students.
Yes, absolutely. I started pre-health advising back in 2009 at a university in the Midwest, a very large university, Research One, and worked with many students while I was there and transitioned to UC Riverside, where I am now in 2014, and have been in my role as director of health professions and pre-professional advising since then. So I've had quite a bit of experience working with students over the past 15, 16 application cycles, students that are applying to medical school, MD and DO schools, but also pharmacy, dentistry, optometry, physical therapy, occupational therapy, vet school, PA, nursing. So a really wide gamut of health professions careers over the past almost 15 years or so.
Wow, that's great. That's wonderful. It's always interesting to hear how different institutions support their pre-health students. So that's great. Let me dive right in and ask you, in your experience, Charlie, what are some of the key skills or experiences that students that can really help students stand out in their medical school applications?
Absolutely. There are really two areas that I think of that come to mind quickly, and the first side is the academic side, and that's pretty well known that students are taking classes, the sciences, biology, chemistry, physics, organic chemistry, biochem, and so forth, and testing in those courses on the MCAT, the Medical College Admissions Test. The second piece is really, I think, wider and more deeper. And that's the how do I know I want to be a physician? Do I have the competencies? Do I have the experiences? Am I altruistic? The caring piece. And I often share with students the AAMC, which is the Association of American Medical Colleges, has a really great tool that's a competency worksheet. There's about 17 competencies on there right now. And some of those things are service, their oral and written communication, their dependability, reliability, being able to adapt to certain situations, cultural humility and awareness are on there, as well as other areas that are needed for students to, I think, really understand what this profession is. And also to be able to be that type of care provider that we want in our physicians, dentists, pharmacists, whomever. And so we spend a lot of time talking with students about the document, and many of our students are doing things on campus or in their community, but it's a really good tool to really have a concrete conversation about why are you interested in healthcare? What does this look like for you? This isn't a job, but it's a career. And so I really enjoy talking with students about that as early as junior high or high school, through college, and as they're moving through their undergraduate career to really discern, is this right for you, this field?
That's great. It's awesome insight. It's always helpful for students to really understand what admission committees are really looking for beyond that GPA and the test scores. So those resources are really important. Let's talk a little bit about language and communication. How valuable do you think Spanish proficiency is for pre-health or pre-med students, both in terms of connecting with patients and strengthening their applications?
Well, in California, about 30% of our population are Spanish speakers or speaking Spanish in the household. So that's pretty significant. And so I'm on a campus where students embrace um, um, multiple languages. Spanish is often the first language that's spoken at home, and certainly in our community as well, in hospitals, clinics, educational areas, and so forth. And so I think it's really important, whether you're in California or even across the US. I think about 20%, 18 to 20% of households in the United States speak Spanish. And so I think it's really integral for students to understand this and to know that when you're working in healthcare, you are considering being a physician, that language, relationships, the ability to communicate is at the heart of being proactive in healthcare and also dealing with more acute situations that are surfacing, bubbling up right there in your office or your clinic or where you're practicing medicine. I like to talk about this with students and as they're looking to really oftentimes increase their competitiveness to get, I don't like using that term, but they often come in and ask like, what can I do to gain more skills, to be more competitive? And so I try to use that time to say, well, think about what type of provider you want to be. And usually I want to be caring. I want my patient to feel comfortable with me. I want their family to feel comfortable and trust me. And so, as we have that conversation and start to really think about who your patients might be and what geographic area you might be working in, oftentimes language comes up, and for us, Spanish. And so, I think it's really integral for our individuals, our students, or those who are interested in going into healthcare to be bilingual or multilingual and doing this very early on in college, I think can be a really great opportunity because you have so much support. You have peers, you have tutors, you have organizations that will allow you to really build in not just the language, but the culture, maybe political issues, healthcare issues, travel, tourism, fun things. And it just really makes that ability to learn and grow, I think, much more exciting and that you're able to lean into it a little bit more.
Right, providing that just different perspective. And I always tell students, perspective is huge in whatever it is that you're going to do in your future. Now, more broadly, how does bilingualism impact employability and career opportunities in healthcare today?
I think the more skills that you have, the better that you have a chance of getting into a position. I think about healthcare in our area, and I think of everything from home healthcare to going to the clinic or going to the hospital and being able to work or take care of those that are in need. And so employers are always looking for do you have the technical and functional skill of your job? That's often number one. But then with that too, how do you communicate? What's your level of service? Are you making someone feel comfortable, heard? Are you able to communicate with them? Those are things that are really important with the function and technical piece of the job. So I think employers are always going to appreciate that students are able to speak multiple languages, and they're going to be able to communicate with a wide variety of individuals. And that's so true in healthcare, whether you're taking care of someone who might be elderly and you're having to communicate maybe with a spouse or children or other caretakers, or it's a young child. Um, so the more that you're able to be able to communicate and maybe that's in multiple languages. I think employers are you're going to rise to the top in that pool of applicants.
Yeah, that's a great point. Definitely culture and communication go hand in hand. Let's talk a little bit about shadowing and clinical experience. I know a lot of students that are watching this today are pre-health, pre-med students, and we hear a lot from them saying that it's a little bit difficult sometimes for some students to find substantial shadowing experiences before applying to medical school. Charlie, from your perspective, how challenging is it for students to secure meaningful shadowing opportunities and maybe touch a little bit on what barriers do they typically face?
That's a great question and something we talk about in our office frequently. Um, since the pandemic, it has become even more challenging. Before then, it was challenging, but I think since 2020, it's been really difficult for our students that are not in clinical programs already to go into schools, or I'm sorry, to go into clinical settings and get shadowing. Um, a lot of our students will they'll reach out to their own physician or they'll reach out to a local clinic or hospital and they're told, we're not able to do this due to HIPAA, which is a health privacy law, or we have a lot of concerns about social media usage and again, since COVID, there's been an awareness of bringing in illness into hospitals, clinics, and so we've seen a significant issue with students being able to get shadowing. And shadowing is so important because you really need to see what that individual is doing in the context of health work or the environment that you might potentially be working in. And so we have really relied on partners, organizations through medical schools or other health professions programs that have summer programs to allow students or to work with students to get that experience. We've also been very fortunate to get to know you, Patty, and your work with Shadow Abroad as a way for students to be able to have this immersive experience where there's a little bit more of an opportunity outside of the US to get into some of these clinics and hospitals and experiences because they don't have maybe some of the same rules or internal policies there that we do here. But it has been a significant problem, and it's really tough because for some of our students, they want to know before they're advancing in their coursework, um, how do I know that I really want to be a physician? And so they may be volunteering, but they may not have access to see a provider in that setting. And so they're really looking for, and we encourage that. To be able to know what a physician does or what a PA does, so that you're able to really affirm, yes, I'm willing to move forward in my education and the cost with that, based on the experiences that I've had.
Absolutely. I think that being able to see a real life, the real life of a healthcare provider is, more important sometimes than some students value, right? So, how would you say this international shadowing experience compares to US based experiences? Because I know that some students say, oh, is this going to be enough? And we always say, well, this is, the tip of the iceberg. This is where you can get lots of shadowing hours in, you can get that experience, but you still have to do some in the US as well. In what ways can this type of experience influence an applicant's, for example, personal statement or medical school interview, and what value is given to this type of experience?
I think going abroad, having experiences abroad is always enriching in many levels and many areas. Specific to health professions or applying to medical school, what I think that can be written about and understood from a medical school admissions perspective is that the student was able to kind of journey out and into the unknown and go abroad and embrace a different culture, maybe be working, living, breaking bread with people that they don't know. They're from other colleges and universities around the country or maybe even around the world. And so you're going, you're learning, you're being in this immersive experience. You are, getting up every day, you're venturing down new streets, you're eating different foods, you're meeting health providers that may be speaking a different language, but they're doing the same things that we do here. Healthcare, whether it's in California or across the US or globally, it's pretty much the same in terms of the anatomy structure of the body and the approach to being caring and altruistic and wanting to provide the best care for that patient. So I think there's a lot of similarities in a in the approach to taking care of the individual, and there's a lot of differences in just looking at how different healthcare providers might be involved, how maybe in certain cultures the family is more involved in being present in that patient's care as opposed to certain other areas. So I think that medical schools and health professions programs can see that you went abroad, you had an experience where you've lived, you've learned, you've been involved with others, and it's really enriching. And I think it also allows the individual to feel that they've had an experience that, when they're problem solving or they're trying to figure out a situation, that I think they feel a little bit more encouraged because when you're abroad, you just have to figure things out. It's not always as easy as it is being at home. And so I think that for admissions committees, they see that you've been able to work through those situations and you're coming back and you're sharing about them. And I think just personally, you grow a lot. I studied abroad when I was in college, and I think about that experience a lot. It's really given me in my own career the ability to adapt and I think problem solve, and especially doing it when you're so young, it allows you to really kind of develop this skill set to incorporate the rest of your life. So I think academically, I think in terms of graduate professional school, and I think personally as well, you get a lot from being abroad and going through these types of programs, experiences.
Absolutely. Thanks for that, Charlie. Now, you mentioned the core competencies, the AAMC core competencies, and I know that's part of the what is viewed during application processes and what admission officers are looking for. Why is cultural competence so important in healthcare today? And how does a student prepare for that area um, in their admission process?
Cultural competence is so important because we are of many people, our backgrounds, many backgrounds are similar and different. Our cultures at home are similar and different. And we all, because many of us come from different backgrounds, it's important that whoever we are working with or who comes in front of us, that we are respecting each other as individuals and that there's trust in that we are supporting each other. So the physician or health provider is displaying, trust by listening to their patients, by good eye contact, trying to get as much information from them as possible to demonstrate that they're trying to help. And I think that's really important because we all probably have some biases within us that just happen through the communities or the culture or where we live, or maybe because of the experiences we haven't had yet. And I think it's really important to be able to develop a relationship with someone so that they trust you. When you think about healthcare, if you will, it's a service where you are, as a physician, you're walking into a room and you're expecting someone to share their very deep, intimate life, everything about their life or their health or their body, with you that you've just met in maybe a few minutes. And so it's important to, understand the culture through experiences, through class, through student organizations, through going abroad, to really understand that we're all very different, but there are structural ways to respect and to learn how to build trust. And those are things that I think through whether it's coursework or an experience such as Shadow Abroad, that you make time to really understand and think through that. And you also see that. I think there are a lot of really great health providers that you shadow and you look at how they are really leaning into their patient or their patient's family. And they might look nothing like them. Their language may be different. They may have a different background, but they're able to, in a very short time, create an environment where I'm here. I'm here to help you. We need to go through these certain things and to be able to, um, you know, to be able to do that in a short amount of time, I think one learns that, there's a lot of things that in terms of their cultural surroundings that they need to understand or approaches that they need to move through to be able to have that trust and respect.
Mm.
And I think we're all learning, like continuous learners. And so I think about my work. I've been working in my career for over 2 decades now, and I still approach my work that I'm going to learn something new in my field every day, whether it's through from a student or students or a colleague, a professor, or I'm out meeting with someone at a medical school. I'm always learning something new and different. And so I think you have to have that in the back of your mind as you're moving through your work to be able to, I think, be the best provider, clinician, cheerleader, supporter that you can be for your patient and their family and for the field of healthcare.
That's great. Thanks for that perspective. It's very interesting. I think all of those core competencies that are listed there have layers, and that we talk about that with the students as well. It's getting to know you. It's showing a little bit about who you are as a person, as a future professional, as a student, as a part of the community and society. So I always say, look at all of those layers, like you mentioned. How are you going to be able to associate with others? How are you going to fit into this culture? What are you looking for in an answer, in a word, in a gesture? And all of those things become very important in all of those areas. So thanks for that. Now, for some practical advice, what recommendations would you give a student who wants to strengthen their medical school application?
Yeah. Well, I would probably encourage that student to start looking at the application. There's always this question of like, how do I get started? Maybe I'm taking the classes. What is the next thing to do? And what I will often do with students is I will pull up the application, the AMCAS application or a COMAS application or whatever area of healthcare that they're looking to apply to. And we almost sort of do this reverse experience. And so here's the application. Here's if you were to apply today to medical school, these are the things that you would be asked. These are the experiences that you would be asked to describe or the essays that you would be asked to write. And so using that as a tool to get students to think about, where they are now and where they want to be. And so for some of our students, they are just getting started on the journey. And so they look at this and we will go through it together and say, okay, well, right now you're working on coursework. Now I want you to think about clinical research and service opportunities. Is that something that you think you're ready to explore? And oftentimes it's yes, or maybe the student has said, yes, I've been volunteering and I would like to step that up. I would like to maybe do some shadowing. And we may talk about, well, do you want to do something on campus in the community? Where are you from? Are you looking to do something in the summer, whether that might be in the state or across the country or maybe abroad? So try to have those conversations with students so they're thinking that it's not just here or in the community. Many of our students like that, but some students start thinking, oh, I can go away. And, how is that organized or how is that supported? And so I generally like them to have the application, posted above their desk or saved on their computer, not because you're just working everything that you're doing to make it fit into that application. That's not really the activity or the advice here, but it's just to think about how that's structured. I know for many of our students that are in college, they will talk about their degree plan. So they know I'm in my first semester of college, my first quarter of college, and they have their degree plan, and they're able to map that out over 4 years to finish their degree, and it makes sense of what they're trying to do. So I try to follow that same logic for medical school as well, and to get students to think about each term as they're going through school, or moving into the summer. What does that look like for you? What experiences do you want to have? And some of our students will say, I want to do something, but I don't want to take classes in the summer. I want to
Right.
be abroad. I want to shadow. I want to maybe do research, but I don't want to take classes. And so leaning into that and sharing with them what's available. So that's generally my approach for how students might look to move along and think about what's available. And then the last thing that I will say is that college moves so quickly. If you're starting school, you're thinking, I'm in my first semester, first quarter, I'm graduating way down the road. Not necessarily. It happens. And here you are, you're rolling into your junior year and maybe senior year, and you're thinking, I haven't really tackled some of the things that I thought I would do. And so that's why I think it's important to have a list out, have a goal list, have some areas that you want to work on, and have some dates, goal dates of how you might want to approach those.
Well, that's wonderful advice. Thank you so much for that. Um, when students are looking at a program like study abroad, they're worried about, I like this, it sounds great. How am I going to make this happen? And funding is often a big question for students. From your experience, what are some effective ways that students can explore funding options for a program like this? Now, I know it's different for students across the country, but perhaps you can talk a little bit about your experience and what is available for students, for example, in California.
Yeah, absolutely. So funding is a very popular question and something that we deal with often. I will say that many schools, ours included, often have funds that are available for, we call them high impact practices, but they are really things that get students excited about learning, or hands-on experiences, living learning experiences. And sometimes they are counted for credit and sometimes they're not. But many colleges and universities know that these types of experiences get students involved, with other students, with faculty, with student services personnel, that often even push the student into career opportunities. So we have some funds at UCR that help support students that are looking for a summer experience that's not paid. And so way that we do it is, the students that are not getting paid, they can apply for funding through our financial aid office that's also supported by undergraduate education. And that will be reviewed based on what they want to do. And we even students that are making a little bit of money but not making enough through their experience to pay, housing or food or that type of thing, they can also apply as well. So there are many colleges and universities that do something such as this. Oftentimes donors, colleges and universities work with the university advancement and donors to donate money, to support students in their types of fields. So what I would encourage you to do is, if you're looking at something and you're not really sure exactly how to pay for it, I would talk to your study abroad office. I would talk to your financial aid office. I would talk to your advisor on campus. Most of us are in the know with things on our campus, and we can help you do some research to figure out, what funds are available, how they can be used, and that type of thing. And I would say do that early as you can. Things like this, if there's money available for these types of programs, it typically goes very early. And so if we're talking about, I'm going to use an example, we're recording this in November, and I'm already talking with students about summer experiences in 2026, because a lot of the applications, funding will be gone probably by January. So if you see something, reach out, financial aid, study abroad, your academic advisor, or a faculty member that you're close to on campus.
Absolutely. Yeah, that's absolutely great advice. And we always tell our students, go out and talk to your advisors. Not every student knows what's available to them. Not every student has reached out to their advisor, especially the earlier years. And we're always saying there's so much information available to you, so much guidance and support that please do go out and find it. And so, yeah, that's a huge piece for students. There's so many ways to look at it. Shadow Abroad also wants to support students. We have some partial scholarships, and the foundation has a revolving fund as a loan for students to take out if they need it. So, talk to your advisors, both at Shadow Abroad and at your homeschool. It's really important for you to do that. Um, and just before we wrap up, Charlie, I know you're very busy and we thank you for being with us. Is there anything else that you would share about the importance of language, culture, experiences, international shadowing, anything that future healthcare professionals, like the students watching this today, should keep in mind?
I think the opportunities that come in front of you that are related to education, cultural, human development, are really significantly important and will build into your life as a human and as in your career. I think that having the ability to have these types of experiences is just, you cannot put a price tag on the experience itself and how you will use that in your career, in your life. As a college student or a recent college student, you have so many opportunities. And I really encourage my students to look, and I would encourage you to look at what's out there at your institution, or if you've just graduated, what does your institution offer as an alum or other supporting educational um, entities that offer some of the things that you want to experience. Um, I think the globe is very complex. I love what I do in education. I know it's the right career for me, but things are always changing, and a lot of the tools that you have access to as an undergraduate through language, through organizational communication, through critical thinking, through international studies and going abroad, if you do those things, I don't think that you'll ever say, I wish I wouldn't have done those, or wasted my time and money doing that. I don't think that at all. I think what you'll find is that you're probably a happier human being because you have a little bit more understanding of the surrounding around you and even afar. And I'll also think that you will make connections in whatever you do, whether that's in healthcare or you go into policy or education, or you decide from an experience such as this that you want to go abroad and open up some type of health or NGO or organization that helps support those that maybe you experienced when you were in college. So take advantage, talk to faculty, talk to your advisor, talk to people on your campus. That's you're never going to go wrong doing that. And college comes and goes, and so I think that taking advantage of the opportunities that are there are going to allow you to have the most rich experience now and in the future.
Thank you so much, Charlie. It's been a pleasure speaking with you and hearing your perspective on how students can prepare to become compassionate, culturally competent healthcare providers. And again, thank you for your time and your expertise. We truly appreciate your commitment to supporting next generations of healthcare professions. Thanks,
Absolutely.
Charlie.
Thank you, Patty.